White House is telling all Americans over the age of 50 to get vaccinated against COVID-19. And this comes as the latest Omicron variants, BA.4 and BA.5, quickly spread across the country. According to the CDC, those subvariants are now responsible for more than 80% of all new cases. So, here to discuss is Dr. Celine Gounder. She is the editor-at-large for public health at Kaiser Health News. She's also an infectious disease specialist and epidemiologist at Bellevue Hospital and New York University's School of Medicine. I'm so glad you're here, man, because I feel like from day to day, the intensity of my concern changes, and it's going up every time I hear more information about this. So, first question, cases are rising due to the spread of these latest Omicron variants. Do the vaccines work against these variants, and are the vaccines being updated?
The vaccines work against the variants. I think that's a really important message to get across, particularly against severe disease, hospitalization, and death. And remember, that is what vaccines are really meant to do.
That's how you define work. Not that you'll never catch it.
Exactly. Right. And so we have the extra bonus that, very soon after you get a vaccination or a boost, you do have pretty good protection against infection, but that doesn't last long. Think of it as like a honeymoon. And what you're left with is that protection against severe disease, hospitalization, and death. And so what we are seeing is in counties where vaccination rates are lower, so say between the 30s to the 60% fully vaccinated, that's where we're seeing hospitalizations really go up. So the message is, if you're not up to date with your vaccines, get up to date now.
I remember you saying that these variants look like the virus looks a lot different than our previous Omicron, I guess. The testing kits that we have at home, will they even work? Will they identify this?
They do.
Okay.
The test kits do work. Sometimes people will have symptoms before they test positive on those tests, and that's because your immune system is kicking in even earlier because it's recognizing the virus like it's supposed to. Either your immune system has previously been exposed through vaccination or maybe through a prior infection, and so it's already learned, and so it's just kicking in sooner.
Okay. How should we be behaving now? I take the train every single day, and I've watched as they drop the mandate and maybe 50% of the people stop wearing their mask. But as every week has gone on, fewer and fewer people are wearing masks. I mean, should we be going back to kind of the defensive posture that we had before, where we masked up and tried to stay outdoors?
Well, there is a difference between mandated, which is you have to do, and then there's just common sense. You got a lot of virus in the community. The CDC recommendations are currently that you should be wearing a mask when you're on public transportation, for example. And I keep hearing people who have recently come down with COVID, and they're saying, well, everybody around me wasn't wearing a mask. Isn't that okay? But that's the problem. Just because everybody around you is stopped wearing a mask doesn't mean it's safe.
Why are people who are double vaxxed and boosted, why are they still getting this?
Well, Omicron was a big game changer, very different from Delta. And then even within the Omicron subvariants, now we're on BA.4 and 5, each of those has been progressively more and more different. So they are better at dodging, evading the immune system than prior variants. But again, the key here is that you don't get severely ill, you don't end up in the hospital, you don't die if you are up to date with your vaccines.
It's still rough though, man. I mean, I do know people who have gotten infected recently, and they're pretty sick. They don't go to the hospital though, and they have recovered, which is the most important thing. Dr. Celine Gounder, thank you very much.